static. That is called auscultation, and it's done by the stethoscope. When doctors use like the stethoscope to listen to the heart, to the lungs, and like to the belly or even to our blood vessels. They do this all the time. So I'm sure you have seen this before. So what exactly are they listening for? So for the heart, sometimes doctors can hear like murmurs in the stethoscope that indicates narrowing of your blood vessels or backflow in your blood vessels, which is not good. Sometimes they can also like hear like gallops, which means an extra like third or fourth heart sound that can indicate heart failure, or something called ventricular hypertrophy. That means, one of your heart chambers is getting thicker. Once they get thicker, they become less flexible, then they will be less efficient in pumping blood. So that can be, indicated by listening to the heart. Sometimes you can hear, rub sounds that indicates inflammation or pericardium. And doctors also listen, for your heart rate and reason. So sometimes your heart beats too fast or too slowly, or sometimes they beat irregularly. There's a lot of information. Then they can also listen to, the lungs. Sometimes they hear like wheezing that indicates, narrowing of airways, which indicates asthma or COPD. Sometimes they can hear other sounds, and that can indicate like fluid in the lungs, which can suggest like pneumonia or heart failure. And sometimes they hear like low-pitched sounds that can indicate like mucus buildup in the lungs. Sometimes they hear like reduced breath sounds that can indicate collapsed lung or like a fluid around the lungs. Then, they also listen to, your intestines. And then when there's too much or too little, acoustic signals, then, it's not good, And they even listen to your blood vessels. So those are called, when they hear like flutes, that means there's